not to be the Debbie Downer, there was a published study in the urology literature 2 weeks ago of 400 men with prostate cancer, which is about 4 times larger, I think 4 times larger than Dr. Ornish's study published in 2005. The setup was, if plants are so good, the control group should try and eat 5, and the intervention group should try and eat 10 servings a day. There wasn't any difference in outcome recurrence.
But they weren't vegan. They weren't vegan, though, right?
They didn't ask them to reduce meat and dairy, so it may be that that's not enough, right? But it is, it is out there, and the headlines are all over that vegetable-heavy diet had no impact on cancer. It's just brand new and still relevant. Thyroid, 2 minutes, maybe 1 minute. I'm not an endocrinologist. However, there's hyperthyroidism, Graves' disease, an autoimmune disease. Maybe you've been radiated as a child. There are people that take excess iodine and drive their thyroid into a kind of a manic state. So if you're supplementing with iodine, it's about 150 micrograms a day, not 15 grams a day, as one of my patients recently just did, and induced hyperthyroidism. But the relationship between diet and Graves' disease, I don't think is well known. Autoimmune diseases may be sick gut. Plant diets may be better for leaky gut. These are all concepts. I don't think it's been tested. Hypothyroidism studied in the Adventist Health Study, where again they segregated vegan versus lacto-ovo versus pesco-vegetarian versus omnivores, was lower. The most common thyroid disease, hypothyroidism, was less frequent in the vegan population in Loma Linda. There's one woman who ate 4 pounds of bok choy a day, reported in the literature, that developed goitrogen and myxedema coma, severe hypothyroidism. Don't eat 4 pounds of bok choy a day, apparently. There's not a lot of cases, even though there's a whole lot of discussion about cruciferous vegetables and thyroid health. I mean, it's the rainbow. It's rotate. It's don't eat any single food to excess would be a pretty good principle.
Just one thing I'll add to that. High estrogen levels are related to hypothyroidism that isn't autoimmune. And so the relationship between eating a plant-based diet is that even before the weight loss starts, the estrogen levels come down, and I think that's one of the mechanisms for the positive effect.
And maybe xenoestrogens, all that you're getting from animal products directly.
And I think the last item on the menu here is eczema. And eczema is definitely not my area of expertise. I could take a stab at it and say that I think we need a very anti-inflammatory diet and make sure we're not eating things we're sensitive to. And I think, Pam, you could probably say a lot more about it, but anti-inflammatory diet, of course, means you want to reduce pro-inflammatory foods like meat with a lot of heme iron, for example, and anti-inflammatory foods, colorful fruits and vegetables, lots of herbs and spices, fermented foods, green tea, all sorts of other plant matter, and in a very unprocessed form. And I think that's what we've been talking about. That's all what we're trying to do. But certainly for some people, I'm sure it's just a sensitivity to some food, and it could be almost anything. And so it's not always easy to figure out what it is. An elimination diet may be the answer, but I think you could probably add a lot more.
I'll just add a couple of things. First of all, eczema is a pretty good predictor of future autoimmune disease. So if you can stop it, it often prevents more bad things from happening. The two food intolerances that are most common is dairy and gluten. Mm-hmm. And if you take those foods out of the diet, follow Brenda's guidelines for an anti-inflammatory diet and take high-dose probiotics, usually you can get rid of it. And people who are compliant do get rid of it, and often that's just the end of their immune dysfunction journey.
Thank you.
Do you use a special probiotic? Like when you say high-dose probiotic, what are you using?
Well, it depends on the person. If you're a practitioner and you're going to use these in practice, I always tell people, find a company that you have confidence in, that doesn't put their stuff on the shelves, because the longer it sits, the more it degrades. It really doesn't have much to do with refrigeration as much as time on the shelf. So we found a company in Canada that ships the stuff to us like next day, Like
But do you order like a certain, like in your eczema patient, a certain microbiome and weight loss a different one?
Well, it depends on what's going on with them. So for example, a really gassy, bloated person, if you give them a high-dose probiotic with some type of prebiotic in it, they won't be able to leave the house. They'll be so miserable. So you do have to tailor the product and to the person in terms of what you recommend to them.
What
And
about bacterial strains? Any particular
yeah,
ones?
yeah.
Like Bifidobacter for
Yeah, you
bowel.
start with the two-strain product because the Bifidobacteria and Lactobacillus are the two strains that seed the gut in the beginning. So we get some of these people who've had 24 rounds of antibiotics and they've taken prednisone, they take NSAIDs every day. I mean, there's nothing down there. So for those people, we start with, if they're in really bad shape and uncomfortable from a GI perspective, we'll start with a low-dose two-strain product and then work our way up from there until we get to medical food. But I think it's best to get these from practitioners who have confidence and suppliers who do studies on their products. I don't like structure function claims. I like companies who do research on their products.
Do you use fecal transplants?
Well, you can't really use fecal transplants in the United States legally unless other than to treat C. diff. We've had people go to Thailand and get fecal transplants because they had the money to do it. Unfortunately, there's a lot of pressure on the FDA from the drug companies who finance the FDA to not allow this to go forward. There's really not much that can go wrong. One study that was done on autistic children, for example, showed that fecal transplant within 12 weeks allowed for something like 14 months within just a few weeks, 14 months of developmental gain. Because autistic children it's a gastrointestinal problem to a certain extent. So it should be allowed, it should be available to everybody, but the FDA is doing everything they can to make sure that it's not. And I have physician friends who are gastroenterologists who would be happy to do fecal transplant on lots of patients, but are just not allowed to.